So good evening and a very warm welcome to our webinar jointly hosted by GenesisCare and Brohn UK. My name is Sally Sadiq and I work for Brohn as the partnership lead with GenesisCare. If you would like any more information about GenesisCare and Brohn, or indeed Sophie Sabbage's amazing offering from today, then you can see that on the slide at the moment. And if you are able to take a screenshot or take a photograph from your phone, you'll be able to visit those links later. So this session lasts an hour and we will be recording it so that both organisations can use it to further help more people with cancer. We will be using a short polling questionnaire at the end of the session as we're keen to know if this session has met your needs, and your answers will be anonymous. Today's session is part of a series of webinars on the integrative cancer care, treating the whole person approach, which will cover various ways that cancer treatments like surgery, radiotherapy and chemotherapy can be combined with lifestyle and complementary approaches to reduce side effects and improve outcomes for people affected by cancer. Today's topic is how to reduce the impact of fear on medical outcomes and well-being. Dr. Catherine Zollman will be posing questions to our very special panel guests. If you would like to ask any questions on this topic, please use the Q&A function. We'll be keeping an eye on the questions coming in and raise them with the panel if time allows. We may not get a chance to answer all of the questions in the limited time, so please bear with us and note that panelists can't answer any questions that are related to individual circumstances or cases. And please note that all opinions are the panel's individual opinions and they are not representative of either organisation. So I'm now going to hand over to Catherine. I'll stop sharing this slide and over to you, Catherine. You're on mute, Catherine.
Sorry. Thank you, Sally, and thank you to all of you who have chosen to attend this session, which promises to tackle one of the really important issues facing almost everybody, I think, who's faced a diagnosis of cancer themselves or in somebody close to them. As Sally has said, integrative approaches allow us to take a broader perspective and use more tools to help address these problems. And so I'm delighted that we've really got a representative panel here, including Dr. Anne Savory, who's a consultant oncologist, Sophie, who's somebody with lived experience, but also with psychological training and background, and Hannah, who's one of the GenesisCare Brohn UK partnership counsellors who offers counselling support to people who are going through treatment at any of the GenesisCare centres. And also I'll be able to give a perspective of an integrative doctor who's used, over the course of my training, I have made it my business to find out a bit more about some of those broader tools like lifestyle medicine and like a variety of complementary medicines and therapies that may be applicable to this situation. But I think what I'd like to do is start off with Sophie and allow her to kind of, she's done a lot of thinking and a lot of talking and a lot of speaking and a lot of writing about this area, and I think she'll be able to put the context of why we think this is an important issue to tackle, why it's often not addressed in a way that really helps people move on, and what we can do about it. So I'll hand over to Sophie.
Thank you, Catherine. And hi, everybody. This is one of my favourite topics because I think it's one of the most neglected challenges in cancer care. I'll weave a bit of my story into this as we go. And I also want you to know that I've done quite a lot of research into this. When I write about it and speak about it, I've gathered a lot of data on this issue over the past. I've been living with stage 4 lung cancer for over 6.5 years now. And I've worked with thousands of patients in the last 6 years to help them through their fear and into a place where they make the wisest decisions that they can possibly make. I'm going to start with a little personal story. So this morning, my oncologist emailed me to say that I need to go to the local hospice. Now, that's what I call a life shock. And rationally, I knew this was to help me manage the constant nausea and frequent headaches that I've been experiencing for several months now, the cause of which remain undetermined because my scans show that the cancer is stable, which is stable rocks, as we know. But this morning, my fear said, this is the beginning of the end. It's game over. Hospice means game over. Now, all we're going to do is, this is what's going through my mind, is mask the pain and give up on finding a solution. And if I agree to this, then I'm going to be giving up too. All that went through my mind the moment I read the email. And this is how fear operates, folks, because those thoughts caused me to be afraid. It wasn't the email asking me to go to the hospice. It was what I made that mean, generated fear right here in my chest, and a bit of anger, actually, if I'm honest. But fortunately for me, I'm very familiar with fear. And I know that when I'm afraid, I'm almost always telling myself something that is not true. And I'm very skilled at bringing myself back to reality, which in this case is that the cancer is stable. I don't have new brain mets. I'm not dying. We are still investigating. The game is not over, and he just wants to get my pain under control. And so do I, very, very much. I may even have a splitting headache while I'm speaking to you. So this has been going on for a while. But I needed to get through the fear, which dissolved when I brought myself back to reality. And only then did I become open to the possibility of going to the hospice tomorrow at the beginning of my daughter's half term. That one piece is still a resistance factor for me because it is my daughter's half term. But the fear is not going to make that choice for me now. Now, I'm telling you that story because I'm speaking to you today as someone who feels fear easily, who faces it willingly, and who knows how to pass through it into clarity, creativity, and wisdom. I'm also speaking to you as someone who, well, BC before cancer, I taught many thousands of people to shift their fears and bring their creative, courageous, authentic best to their worst moments for over 2 decades. And I'm speaking to you as a stage 4 cancer patient whose ability to transform my fear was one of the things that saved my life when I was just given a few months to live back in October 2014. What I don't have for you is a magic pill that permanently removes fear. I'm sorry, the only permanent solution I've come across is a frontal lobotomy. So I don't have that magic pill. But what I do know is that if you are human, fear is part of the package without exception. And I'm speaking to you as someone who has helped many, many cancer patients build fear medicine into their treatment plans. So there are ways to address this thing. But as I had it this morning, I still get scared. I just know how to get myself out of that emotional state. Excuse my dry mouth. I'm on a lot of medications. So why does it matter to address our fear? I think it's really important to name this because it is well known and well evidenced that emotional dis-ease can lead to and worsen physical disease. This is not news. It's well known and well evidenced that trauma manifests in physical as well as psychological ways. And in case there's any doubt, hearing the words "you have cancer" or "you have incurable cancer" is a traumatic moment that then becomes an ongoing traumatic experience. So with that in mind, I mean, honestly, I think this belongs in the kindergarten of awareness when it comes to cancer care. And yet, as far as I can tell, it is still a very neglected issue when it comes to patient care. I mean, I was handed lots of leaflets about what to expect from cancer treatment, from radiotherapy, from chemotherapy, how to apply for blue badge parking, but no one asked me what I was feeling or if I needed emotional support. And I watched myself dying of shock within 24 hours of being told I was going to die. And I knew I needed to treat my mind and my fear while my medical team figured out how to treat my body. Now, I later learned about the Nocebo Effect. You may have heard of the placebo effect, but I learned about the Nocebo Effect, and specifically a test was done probably 7 years ago now in Sweden, where 500,000 people were tested for cancer. And of those who tested positive at any stage, there was a 29.6-fold increase in heart-related death within 1 week, which means patients are literally dying of shock. And for me, that is enough evidence to make this a critical factor to build into treatment plans for cancer patients. I mean, that's enough evidence right there. Now, I'm really well aware that some patients don't want to talk about their fear. They avoid their fear. They don't want to admit their fear. Many of us are, in effect, afraid of our fear. And I really get that. But I want to give you my 5 top reasons for addressing fear when you're living with this disease. I think we can send out these 5 points later, Catherine. So firstly, if we don't take hold of our fear and shift our fear takes hold of us and it makes some of the most important decisions we may ever make, life and death decisions. Secondly, fear does not make wise decisions, folks. It just doesn't. I mean, occasionally it'll say, get out of the way, there's a red bus hurtling towards you. But most fear is born of imagination rather than evidence and reality. And it can often lead us down tunnels that have no cheese at the end of them. An example of this is, well, when I was first, some of you have maybe heard me tell this story before, but when I was first diagnosed with tumors in loads of different places, and I was finally told I had more brain tumors than they could count. And my oncologist said, I've booked you in for whole brain radiotherapy on Tuesday, which was like 3 days later. When he said that, I went into a state of, I was already in a state of terror at this point, having heard I had so many brain tumors. And it would have been very easy for me just to agree to having that protocol done. But I knew I mustn't agree to anything when I was that afraid. And I said to him, no, we're not going to do that, at least not yet, because I knew I needed to go home and shift my fear and then do some research before I agreed to something potentially so damaging to my brain. So it turned out I didn't need the whole brain radiotherapy. And in over 6 years and about 70 brain mets by now, I'm yet to have whole brain radiotherapy. But my fear could easily have led me down that road, my fear and my ignorance. That's an example. Thirdly, if fear doesn't come out, folks, it stays in. So it becomes a toxin in your body while blinding you to possibilities you can only see when the fear is out. So when we're afraid, we can't see what's really so, let alone what's possible, because we're looking through the filter of, oh my God, I've got to go to a hospice and that means I'm going to die and everyone's giving up on me. Well, when I'm looking at the situation through fear, I can't see, actually, they just want to help me manage my pain. And then 2 hours later, my Chinese medical practitioner friend called me and said, I'm coming to do a Chinese medical diagnostic on you and give you treatment at the weekend. So this other possibility suddenly showed up that I wasn't even looking for. So fear closes us off to possibilities and solutions. Fourthly, if you're afraid, then you may survive, but you're unlikely to thrive. So I know I've worked with many patients who are actually free of cancer, but they're not yet free of fear, which means they're not truly free yet. And for me, that is truly sad, to be free of the disease, but not to be free of fear. But it's very, very common. Finally, not my last, but for now, my final reason is that fear, not hate, by the way, fear is the opposite of love, and it throttles our creativity. So as we are facing our mortality, in my view, the two things we need most are love and creativity. The ability to love and be loved, and the capacity to unleash our creativity in response to what we're facing, both our living and our dying. So those are my top 5 reasons for engaging with and addressing your fear. Can you give me a time check, Catherine?
Have you got 5 minutes more to sort of?
Okay, thanks.
And then we'll have lots of time for questions and come back, but 5 to 10 minutes maximum.
Okay, so I have a section that I don't have time to talk about how clinicians and oncologists feed our fear. It's probably another talk, but we have our own fear to manage and deal with. But there are a number of systemic and behavioral issues that need to be addressed on the side of clinicians, quite honestly. I don't think I'm going to have time to cover that. I want to do 2 things. I want to bust a few myths about fear, and then I'd like to teach you a couple of simple skills that you can use to reduce your fear when it arises. So that's what I'm going to give you next. The first myth I want to bust is feel the fear and do it anyway. Some of you may have read that book. It sold millions, but to me, it's one of the most irresponsible books ever written. And I say that because the way out of fear is through it. You know, you can take action free of fear rather than feeling the freaking fear and acting while you're still feeling the fear. I mean, that might be fine when you're jumping out to do a parachute, but it's not necessary, and it will not lead you to the best decisions that you can make. You don't have to feel the fear and do it anyway. You can get free of the fear and then make your choices. A second myth I want to bust is that believing you have to be positive all the time is A, not possible. Good luck with that. And B, it generally equates to the fear of being negative and the notion that being negative will make you sicker. I mean, this is a myth that pervades the cancer world. People are afraid to feel, even touch their fear in case my negativity makes me sicker. But actually, that kind of positivity is exhausting and it's unsustainable, and it leaves your fear inside of you. Just as I often say, it's like putting icing on dog shit and calling it a cake. So emotional healing and freedom comes with authenticity and not with positivity or negativity. And authenticity comes from releasing your fear instead of denying it or covering it over. And on that point, I remember I had a conversation with my oncologist, and he said, well, some of my patients don't want to talk about their fears and feelings. So I respect that. And I even hear therapists saying that too. However, when someone says this, you can be certain that they are terrified. So terrified that they don't want to admit or look at their fear. Now, obviously, there are professional and compassionate ways to approach this, but to my mind, it's irresponsible to collude in this by agreeing not to mention it or take them there, especially when our lives are on the line and we don't have time to waste. Now, I know it can't be forced, but it can be encouraged, it can be explained, and it can be taught. And I think when someone says, I don't want to go there, that's a big red flag to say, take them there if you can. So finally, I'm going to give you a couple of skills that you can use. The first is very simply taking 3 conscious breaths. So the way you do that, and you're welcome to do it with me now, is when you feel anxiety, you take some breath in through your nose, all the way down into your belly, and out through your mouth, like you're blowing out a candle. You do that 3 times in a row. You may notice when you do that, you feel instantly calmer. And it's a very simple technique you can use. Like if you're sitting talking to your oncologist and you suddenly feel full of anxiety, take 3 conscious breaths. Even ask, I need a minute to take some breaths before you continue. It's a very simple way to reduce your anxiety. And the second is a process I developed called the not knowing process. I'm sure a lot of you experience scanxiety. I'm also having scans tomorrow. And fear takes us into the future. It imagines the worst. And often we have nights of scanxiety, waiting for the scans, and then waiting for the results, because we're imagining we know what's going to happen. So there's a very simple method that I teach where you just say to yourself very calmly, or to your partner, or to someone who cares about you, I don't know until I know. I don't know until I know. I don't know the results until I know the results. I don't know until I know. And if you repeat that several times over, you'll find yourself calming down. And sometimes you need to do it again 3 hours later. I don't know until I know. I don't know until I know, because you don't know until you know. And not knowing is very freeing. And it brings you into the present moment, and it allows you to have your life right here, right now, instead of living in anxiety, afraid of what might happen that hasn't happened yet. So those are 2 skills I just want to give you from this webinar. I don't know until I know, and 3 conscious breaths, very simple ways to diminish your anxiety in real time. There are more powerful tools that I have. I'm going to tell you about a workshop that I'm offering, which is all about building fear medicine into your treatment plan, where I go deeper and into the fear and through the fear with people and teach patients how to do that for themselves. So if that's of interest to you, then we'll be giving you information about that later. But I hope this has been valuable for you today.
Thank you, Sophie. And you know, I think every time I hear you speak, another little penny drops, and I hear it in a different way. And I've heard you talk very much about that, you know, and it's a biological fact that the brain is hardwired to think worst case scenario when you are in a state of fight and flight, and when you are in a state of either anxiety or fear. And so it's a very natural thing, and you won't even notice you're doing it, but your brain is automatically wired to think worst case scenario. So you actually have to put that stop there. And I love your I don't know till I know. And I've also heard you say it, that you've kind of encouraged people to write down their thoughts, and by each sentence put, is this true, is this false, or do I just not know the answer? And actually
I teach that on my workshop. I can't teach that in 2 minutes.
It's a very good, even just thinking that you can separate your thoughts into things that might be true, but actually a large proportion of the things that you think are probably not in that category. They might be don't knows, and they might be things that actually, could be completely false, but you're just wired to think that way. I can already see one question in the Q&A, which is asking you to actually please just say a little bit about what you were going to say about oncologists. And given that we've got Anne here to answer that, if you can just in maybe...
Okay, do we have time? Because I want them to hear from the other panelists.
Yeah, I think, well, maybe we could come back to that if we've got time, because I think...
I'm really willing to, but I'm just conscious we have other people with wisdom. Yeah. But I'm very happy to come back to it.
All right, well, let's go round and then we'll come back to that, because I think you've already given us lots and lots of food for thought.
Yeah, so, happy to come back to it.
From your perspective, I'm just wondering, as a busy, NHS oncologist, you haven't got much time, but you're obviously recognizing that this is going on in the room. How do you, what's your relationship with what Sophie said, the emotions that might be coming up? In a consultation, how can you address it? What might be some of the things that you might put into the consultation to help people feel more in touch with their fear and more able to handle it?
Well, I mean, first of all, I have to say that obviously I have been on my cancer journey because I have been an oncologist for 28 years, and it's a learning curve, and I am only one oncologist, and I have my view, of course. But I think, first of all, as an oncologist, you need to be quite comfortable in your own skin. And first of all, I want to make the consultation not comfortable, but sort of trying to make the patient to feel relaxed. And sometimes it happens when you ask the question, how are you? They just burst into tears straight away. And they said, oh, I didn't feel like that, but it just happened. And then you start from there. So my main area is breast cancer, and most of my patients are in a very favorable position that they have a curable cancer. And my job is, sometimes I start the consultation saying that, I'm here to advise you on the possible treatments. But the way I feel my role, that 50% of my job is to give you reassurance and to move on in your life. Whether I'm successful, I'm not sure, but I think I am. So just to kind of trying to put into perspective. And sorry, I'm not sure if I'm deviating, but I also have quite a lot to say, of course. What it comes to my mind is that the patient's fear or anxiety is not at all necessarily linked to the prognosis the way I see it. And I think our NHS healthcare systems in general, they are not really geared up for this. I have some patients who have like 99.999% survival rate, and they can be so anxious, and I worry how they move on with their life. So I think it's kind of what has gone on in that person's life as a whole. So sometimes patients say, because my main treatments that I offer is radiotherapy, and some patients may say, oh, I'm not going to have that, I'm not going to have that. I said, what's going on? And then they say, oh, my great aunt had some radiotherapy, they had horrible burns, and my uncle had lung cancer and he did very badly. So it's just sometimes patients may have fears because someone has died of cancer or might have had very bad reactions. And once we have discussed that, then they are happy to move on and talk about the treatment. So I guess the question is really, is the fear of dying, or is the fear of having horrible side effects? Or, you know, I'm not really asking the question, do you have fear? I think it comes across when you talk to the patient. Am I answering the question at all? I'm not sure.
Yeah, I think it.
Sorry.
I think it might be reassuring for people to even know that their oncologist is thinking about that. And trying to understand what they might be frightened about if they are, you know, if they are expressing that. So, you know, and maybe we can talk, because again, you know, I'm conscious that let's try and come back to the sort of what can we do in the consultation, whoever we are, whatever part we're playing as professionals in that interaction, to help people not be paralyzed by their fear and not feel that they have to manage it on their own, and at worst case, as Sophie said, not let it run the show for a while before they even realize that that is what's going on, and not to make their experience worse. Hannah, I don't know if you've got any thoughts as a counsellor. You often probably have a little bit more time than most oncologists to delve into this. Do you want to tell us a little bit about your experiences?
Yes, yeah, of course. Thanks, Catherine. And yes, I have been kind of thinking about this, obviously, from a counselling perspective. And it was interesting to hear Sophie talk about that red flag when people kind of say they don't want to go there and talk about their fear. And that's certainly something I notice can be a reluctance in patients that I work with. And I might notice, particularly in our first session, that maybe we're kind of skirting round a little bit the fear and the difficult emotions that come with a diagnosis or coming with treatment. And I think that's really normal. You know, as humans, we don't like to really feel those things. They're uncomfortable, they're painful. So naturally, we tend to turn away from those things rather than maybe leaning into them and feeling them. And I guess my role as a counsellor is to gently try and encourage that for all the reasons that kind of Sophie talked about. People also want to protect others. So sometimes it's about finding the right outlet for their fear, the right time and the place to be able to express it and feel it and work with it, because people often say, well, I don't have someone to talk to. I don't want to burden my loved ones. I don't want to make, a sense of protection comes in, not wanting to upset others, which is really, really understandable. And also something that comes up quite a lot for people is, and certainly when I'm working with them, it's like, well, how is this going to help? How is actually talking about my fear, expressing my fear, how is that going to help? Because it's not going to change my diagnosis, and maybe I should be using all my energies to be positive. A bit like Sophie was saying, people kind of think they have to kind of be positive, and actually they expend all their precious energy in trying to be positive, which is ultimately exhausting and unsustainable if it's built on a foundation of someone that's really fearful. So that's why it's really important to engage with the fear, and people say, well, how does talking help? It seems so simple. How does it help? And actually, it can be so helpful. And maybe there's a harsh reality in there that actually it won't necessarily change someone's diagnosis, but there are ways that it can help. So, for example, it can help for a start just to normalize that person's fear. For them to understand their fear, for them to almost have a bit of a relationship with their fear. And from hearing Sophie talk so beautifully about her own experience of fear, you could get that sense of the relationship she has with her own fear. She's come to understand it. And I think that can be really helpful for people. And I think when people have that understanding, it naturally leads into a bit of self-compassion for themselves. Because I hear so often people saying, I should be being more positive. I shouldn't be feeling so fearful. But actually, how can you not be fearful when faced with some of these things that the patients are faced with? How can you not be fearful? And actually, if there was ever a moment to extend some kindness towards yourself, to extend some self-compassion, it's going to be at these moments. And I think through talking about the fear, it can help people do that. And I also think, and I think this is a really big one, through talking about people's fears, it can help them dissociate their own fear from maybe all the other kind of noise and fears that goes on in the cancer world. So I think something happens when people receive a diagnosis, they suddenly develop these antennas, they're suddenly heightened to everything cancer, and they hear about it, it's suddenly everywhere, it's on the news, it's in social media, they hear of a friend who's got cancer in their experience, and suddenly someone is absorbing actually a kind of collective fear. And so being able to talk about your own fears can help you recognize actually what is yours and what is someone else's experience. And that can be really helpful for people, because when they're in the middle of that fear, like Sophie said, it's very difficult to see what's happening. And so people can start to build a bit of a gap and a bit of a boundary of their own experience, which can be really helpful. And finally, in terms of talking about fear, which is obviously where I come from in this perspective, I think there is something transformational that can happen when people talk about their fear. And I realize I'm attaching quite a big word to that, transformational. But we can sit and we can think about our fear and we can go through it in our head, and that's fine, that can be helpful. But actually something else happens when we speak it, when we use our voice. And there is something about using our voice and feeling the vibration and the resonance in our chest, in our heart space, in our emotional center, that can actually shift emotions through. It can bring the emotions up. So they're not being held in the body, like Sophie was saying, they're not kind of lingering and staying in the body and in the mind and in the whole being. So using your voice can bring them up and actually help you to clear them. And the number of times I talk to people in session and they suddenly become overwhelmed and they say, I don't know where this has come from because I've been through this in my mind. But it's the physical act of talking that can really shift things through. So it's so helpful. And having said all of that, I know it's not easy. I know it can be really hard for people. And actually, talking is not always for everyone. It really isn't. And actually, you know, if talking is not for you, there are other things that people can do. There are other integrative approaches that can help people to manage their fear, cope with their fear, explore their fear, build that relationship. You know, and I know the work you, Catherine, that you do in kind of integrative approaches, there are things that can help with that as well.
Absolutely, and it is worth putting a little marker there. And obviously we haven't got time to go into the details of those things, but just to list a few things, pardon me, if talking doesn't feel like it's coming easily, there can be ways to shift your body physiology from that very alarm shock sort of place where sometimes it does feel quite blocked, as Sophie was saying. And definitely things that can ground you in your body can be really helpful. So sometimes touch-based treatments like reflexology, like shiatsu, like massage, can be fantastic at just releasing some of that initial tension. Sometimes being out in nature. Many people, you know, they've done some really interesting work around green gyms, which are being in forests and green spaces, or blue gyms being by the sea, around addressing some of these things. Movement, you know, and exercise, whether that's, you know, creative things. Sophie's talked about, actually, if you get into your creativity, that can help lessen fear, and fear can block creativity. So doing things, if you don't want to talk it, then writing it down, or doodling, or actually dancing. That, you know, some fantastic research has been done around fear and movement therapies, music therapy as well. So there are an awful lot of things, you know, again, some of the sort of approaches that don't distinguish so much between mind, emotions and body. So some of the systems of complementary therapies like acupuncture or traditional Chinese medicine, where you can treat an emotion, and the same for other therapies. you know, and sometimes just feeling you're doing something. So taking something like rescue remedy or a homeopathic preparation may actually just, even if some of that effect is a placebo effect, it can really help you feel that you are taking something for your fear. So I think the integrative world has got a lot to offer, and if people are concerned about that, don't have access or don't feel comfortable initially with the talking therapies, I'd encourage exploring that, those sorts of other things. So let's come to some questions now, because we've had a couple of questions put in before this the webinar as well. But a couple of people have just, you know, I am really interested. This is a wonderful opportunity with an integrative group of professionals to think, what can we do to make it better? And certainly from my experience, sometimes people do feel more traumatized after an appointment with a healthcare professional and more fearful. So maybe, Sophie, could you just speak briefly about any theories you've got about that, and then maybe we could respond to think how might we could do that better.
Sure. I'd like to say I don't think they're theories. These are true stories that I've heard many, many times. And I also want to say that oncologists and clinicians are not psychologists. It's not their expertise, it's not their job to help us through our fears. However, there are some quite common mistakes and behaviors, and I'm just going to give you a few examples, 2 or 3 examples. So I have heard dozens of patients speak about phone calls that kind of go like this. Is this a good time? Are you sitting down? Have you got insurance? We think you should come in. The news isn't good. We can see you next week. I mean, I could probably give you hundreds of examples of just hearing, is this a good time? Are you sitting down? Fear. And then being left for several days to actually find out what the news is. This is very common practice, by the way. Another really common example is that a patient goes to see their oncologist to maybe get some scan results. And the last time they saw their oncologist, it was just them and the oncologist. And this time there's at least one nurse in the room, or 2 or 3 people. And I think it's supposed to be supportive, but it creates the opposite effect. I mean, my own experience of that was my first oncologist, who is no longer my oncologist. When I went to get my PET scan results, I walked in with my best friend, said, this is Catherine. She's here to give me moral support. And he pointed at the nurse in the corner of the room and said, this is Linda, she's mine. She's my moral support. And in that moment, I knew I had terminal cancer. And it took him 15 more minutes to tell me what was really going on. But I hear many, many stories of people walk in and the Macmillan nurse is there and they know they're in deep trouble. Very typical practice. And I think the third one that's common that I really want to mention is the fear of giving false hope in oncologists can lead to cautious behavior, can lead to, you know, kind of dire prognoses, and it creates false hopelessness. I mean, you and I, Catherine, have often talked about the fear of false hope. Giving false hope creates false hopelessness and walks people right into despair. It's very, very common practice. And as I often say, there's no such thing as false hope. I would teach this to every oncologist if I could. There's hope or there is none. There is, and we would prefer to have hope, thank you very much, than have no hope. So, I mean, these are the kinds of things that happen a lot. I don't think they're intended to terrify people, but they're very common triggers for patients.
Yeah, that's really helpful and quite stark. And you and I have talked about trying to find realistic hope, which is hope, but it's realistic. and that's very, I think that is an ideal that we should aim for, and realize that hope is an essential ingredient of being alive.
Yeah, and there's also a fear of getting emotionally involved with my patients, probably training, but that creates a distance and a kind of carelessness, quite frankly, and automatically just doing this is the normal protocol without getting into their own creativity and pushing the envelope. I know many patients who've been given whole brain radiotherapy who didn't actually need it. Many, because that was the automatic thing to do. And that makes my blood boil, actually. So these are the things that make my blood boil. And this is why I'm working with oncologists and pharma now as well. It's systemic.
And that comes back to a question that Mandy's asked, and maybe a reflection from the two earlier questions back to Anne, in terms of what support do oncologists get and what training do they get in handling these things, and how as Sophie said, and I think, when I first heard Sophie say, having extra nurses in the room is not, actually, it may be meant to be reassuring, but actually it may press alarm bells that actually are better not pressed that way. Any thoughts about how we could get it better or do it better?
I have so many thoughts that we would need the whole evening. And I am so sorry, Sophie, that you have had so not so great oncologists. I feel I am, well, I didn't recognize myself in that, thankfully.
No, and they're a great oncologist. I do need to acknowledge my second oncologist is great.
I think the thing is that I recognize, and most of us, we recognize that we don't have time. We don't have the right staff to support our patients emotionally. We have 40 minutes per new patient to do everything. To deliver the news, do the bookings, do the things what we need to do, that's it. And then the time is out. So I am not as privileged to have actually a clinical nurse in my clinic. It's a rare opportunity to have someone there. So hopefully I scare less people. Sorry, what did you ask, Catherine? I went sideways.
It's just thinking about, and maybe we'll come back around to this again, but thinking about how we can do this better for people. And I think I think it's also really important to say that there are some fantastic oncologists who do this. And I think the whole sort of the continuous professional developmental program is too focused on the actual clinical side of things and how many conferences and chemo courses you have done, instead of, I think there should be an element that, like, maybe 10 or 25% of the CPD points should be some kind of a more emotional or psychological side of things. I've done my training a very long time, and we didn't have any sort of psychological training, not a single hour. So there's a great chance of improvement. So there is a long-term cancer plan, and level 4 psychological training for anybody who is in contact with cancer patients is part of that plan, and it is beginning to be rolled out. So at least it's there as an intention. I think what you said earlier about often people are pushed through pathways depending on their physical illness, and more people are sort of, if they've got a good prognosis, then they're being followed up much more lightly. But I think there are also initiatives coming through to say it's not just about the physical side of things. Even if they've got a good prognosis, if they're really anxious, they may need more support. So we should be simplifying these pathways, not just on the physical basis of things, but on the overall health and taking that holistic picture. So I think that's really important to say.
I'd like to also add that I don't think patients expect their oncologists to be psychologists. That's not an expectation.
No.
But there is an expectation of kindness. There is an expectation of asking me how I'm doing and saying, do you need some emotional support? And here's where you can go to get that. I mean, in some ways, it's very, very simple things. We want to be seen as human beings and not as patients or diseases. And a lot of the time we're treated, we're related to as our diseases. And actually, I don't think we expect our oncologists to psychologize, to support us in that way. But we do want them to guide us and show some very simple humanity, which my current oncologist does. He's become a partner to me. That I think it's in some ways that simple.
Yeah. I think there are a few. I mean, there are so many questions coming thick and fast, and we knew this would be a topic that would generate a lot of questions. I think another question that's come out in here is fear of the treatment versus fear of the prognosis. And actually, I think sometimes as clinicians we kind of lump it all into one, but actually I think there's a real opportunity for us to talk to people about the good effects of their treatment and what the helpful benefits are. In my experience, people spend a lot of time talking about the potential side effects, but actually not really being talked through what are the benefits and why they're suggesting this and why this is actually a really good idea to have this treatment, and what are the things not to be afraid of, or if this, you know, if you experience this side effect, we can help you with this and this and this. And again, integrative medicine offers a really wonderful extra set of tools to help manage some of the difficult side effects that people are most frightened of. And sometimes it's just that they don't realize that it's a reversible thing, that they can ask that the dose will be turned down if they are experiencing severe side effects. So sometimes just talking through some of the fears around particular fears of treatment. And, you know, again, I think COVID has added another whole layer there. So question in the chat was often, you know, you're being given very stark choices sometimes, and not given the support to help make those decisions from a place, as Sophie has said, of a little bit more stillness in the body. Jackie's put some really helpful, you know, comments about, you know, about the sort of training that cancer professionals were getting, and Wendy's put very clearly, you know, nurse specialists often do have more training and do have, you know, an approach that can be more holistic there. Sally, do you think, is there anything from the questions that were sent in beforehand that would be worth raising at this point, or if we've got time?
Yeah, I'm just thinking we have 5 more minutes, Catherine, before we need to launch the poll. I mean, there were 2 very detailed questions that were sent to us beforehand. One person who's really weighing up the position of, you know, do they have several more months of life if they choose no treatment, or a couple of years if they choose a grueling chemo regime, and, you know, how can better through this decision. So we've kind of touched a little bit. And then the other one, perhaps we could just close with, which was, somebody was saying that they're finding, you know, some of the significant people in their life don't have the bandwidth to check in with them. And, you know, what advice do you give to stop feeling so isolated or lonely when people are too busy living their own lives to ask how you are?
Great questions. Hannah, do you have any thoughts about that?
Yeah, that's a really great question, and it's one that, you know, I hear a lot, is that people sometimes just need that support and recognise, and particularly over the last year where we've had COVID, there's been so much going on in people's lives that patients have maybe recognised that loved ones haven't been able or haven't had the capacity to give them the support that they're after and the support that they need. And first of all, I would say, for one, you know, is that your perception? Is that true? Because sometimes it might just be a case of, oh, I don't think they're in a place because they've got so much going on. And actually they might be thinking, well, I don't want to talk to them because I don't want to upset them. And then everyone ends up not talking to each other. So first of all, just questioning how true that is, or is that just your feeling? But then also, you know, if that is the case, then finding other sources of support. And sometimes if you don't want to do one-to-one talking with therapy or a counsellor, then group support can be great, that sort of shared experience. And I'm sure probably on the Penny Brohn website, or there are places where we can recommend group support for a kind of shared experience, can be really, really helpful.
Yeah, I do really recommend asking, because actually in your cancer information centre, your cancer nurse specialist, your oncologist, there's a wonderful thing called the Cancer Care Map, which maps the whole of the UK in terms of supportive services. Many places actually do have support that's available, and some places it's actually, you know, on the doorstep. So I think if you think it would be helpful, definitely, you know, charities like Penny Brohn UK are offering free services, both in terms of group support and in terms of one-to-ones. I think somebody has put a really useful question around prehabilitation and doing something that makes you feel more in control. And again, I think that's a lovely way that the integrative approach can help address fear, because when you are doing something rather than just feeling like a passive recipient of these sorts of things, sometimes that also helps reduce fear. And I think, you know, Sophie's course, and she's, you know, her books as well are very, very helpful in helping people work through some of this material. I think we will need to call it a day in terms of the questions. It just makes me think that this is a very important topic that we need to keep coming back to. We've got a short poll that really shouldn't take minutes. It's literally just a couple of questions just to see how you have found this webinar. And if you can just quickly fill that in for us, that would be really helpful.
Has that launched okay?
Yes.
Yeah.
I think people can, as panelists, we can't vote, but I think you should start to see, can you start to see people have completing, when they get through all the 5 questions, we'll start to see some numbers coming up.
It's really helpful for you to, if you're able to do this polling, just for us to be able to plan future sessions. So really, you know, they're all anonymous, but we really take notice of what your answers are. So this is your chance to speak. And I'm also going to share the screen again when I can get the right screen up, because I think people have been asking for that information again, and obviously so they can take pictures of the information about Sophie's course as well. So we'll just wait for everybody to finish. And
while people, you know, if there's any problems with doing the poll, just pop that in the chat. But but another question was, are we suggesting that people challenge their oncologists a little bit more? And I think it's not to set up any kind of conflict, but certainly to feel that your views are absolutely important for your oncologist to hear. And I think that will change the culture and make you feel a little bit more in control. Would you say that's true, Anne?
Well, the thing is that I do think that there may be an element of over-treatment in certain situations. And the way the cancer police, the government targets, and the MDTs run, you have to justify in a big way if you decide to withhold treatment, which when you have very little benefit. So I think it's a tricky one, because, you know, there are a lot of new drugs available. It's not just chemotherapy, immunotherapy, this and that, and sometimes the benefit percentage is quite low, and the drugs can have quite a long list of possible side effects. So I tend to have a very thorough discussion. I mean, percentage benefits is always a difficult topic, but everybody's different. You know, somebody may say, look, I want to have everything if you tell me that I have 1% better chance to be alive. And some people say, no, I'm not having it, whatever, you know, so.
And recognizing that an oncologist, as Anne has said, is sort of duty bound to offer these treatments, but that doesn't mean you have to take them. If you, in the way you weigh it up in your life, means that, you know, just like Sophie's story of the whole brain radiotherapy, actually stopping and thinking, is this right for me? Is this right at this time? Is this my only opportunity? Is this my only option? What else is there? And engaging clinicians in that conversation can be really helpful to address fear as well.
So I think I'll end the polling. I think if we just give it the last minute, we've got 83 out of 102. So if you did want to just finish the poll, that would be great. Oh, it's going up all the time now.
Fantastic. I think people are taking a little while to work it through.
Yeah,
So really,
yeah, absolutely.
I just want to finish by thanking our panel enormously. You know, everybody here has made a fantastic contribution, and I think put themselves on the line a little bit. Particularly like to thank Sophie, you know, who has been not very well and kind of battling with headaches and things, but who felt so strongly about the fact that this needs to be talked about and needs to be brought into a kind of multidisciplinary space like this, so that she was really committed to taking part. So I really just want to thank, you know, on behalf of Penny Brohn, on behalf of GenesisCare, and on behalf of everybody who's listened this evening, really huge thanks to all of you for taking time on your evenings. Thanks to Anne, thanks to Hannah, thanks so much to Sophie, and thanks very much to Sally for hosting us.
Thank you. Sorry, I'm having technical difficulty sharing my screen. I don't know why, because I shared it at the beginning. So just bear with me 1 second while I try and get it up again. It seems to not want to share. It seems to be taking me back to my oh, here we go. Is that sharing?
Yes.
Oh, cool. So I'll just close that down. Can everybody see that now? So I think some people wanted to, it's got Sophie's information there, and also information about GenesisCare and Penny Brohn. And just to say, obviously we are a charity. If you feel that this has been helpful to you and you're able to donate, we would really appreciate your donation. No pressure or at all if you can't, but if you are able to help us, obviously then we can help more people. So thank you very much, everybody. Really appreciate your time.
And if you book for Sophie's workshop using this link, there is an automatic donation to Penny Brohn. So she's again generously made that offer. So that would be a wonderful way of getting something for yourself, but also giving something back. Thank you very much, everybody.
Thank you all.